Happy morning, everyone. Welcome to the YouTube channel of Metier Academy. I hope you are all preparing well for the exams. So from our Metier side, we are putting daily 5 important MCQ, which is helpful for JIPMER and AIIMS NORCET exams. We'll start today's session. The first question. A male client with a spinal cord injury is prone to experiencing automatic dysreflexia. The nurse would avoid which of the following measures to minimize the risk of reoccurrence? The question is telling that patient is having autonomic dysreflexia or automatic dysreflexia, okay, because of the spinal cord injury. So what the nurse would avoid, it's the following measure to minimize the risk of reoccurrence. The options they have given: strict adherence to the bowel training program, keeping the linen wrinkle-free under the client, preventing unnecessary pressure on the lower limbs, limiting the bladder catheterization to once in every 12 hours. So you've seen all the options. Go for the answer. So correct answer is option D, limiting bladder catheterization to once in every 12 hours. Okay, you know autonomic dysreflexia. When there is a spinal cord injury at the level of T6 or above the level of T6, including T6, it comes under autonomic dysreflexia. There are various causes which can stimulate the autonomic dysreflexia. So the first thing is we have seen this bowel draining. When there is a constipation, that will stimulate the autonomic dysreflexia. When there is a linen wrinkle free, when there is a pressure, when there is a stimulation in the skin, tactile stimulation, that also can stimulate the autonomic dysreflexia. Okay. And then option C, preventing unnecessary pressure on the lower limbs. Okay. So these and all can lead to the spinal cord injury, that is autonomic dysreflexia. So what should the avoid? What should the nurse avoid? The key point they have given, what should the nurse avoid? So the answer is limiting the bladder catheterization to once in every 12 hours. No, that is very wrong. We have to do the straight catheterization every 4 to 6 hours. That is the right answer. If you do 12 hours, the bladder will be full. Again, there is a chance of autonomic dysreflexia. So we have to put a catheter for every 4 to 6 hours, or if the patient is on continuous bolus, look for any kinks, any foldings in the catheter tubes and the urobag. That is very much important. So here the answer is limiting the bladder catheterization to once in every 12 hours. That is the nurse should avoid. The question they have asked, nurse would avoid. So the nurse should avoid option D, limiting the bladder catheterization to once in every 12 hours. Clear? Remaining and all, we have to follow it. Option D, the nurse should avoid it. Clear? Okay, next question. Which of this is not a gynecological disease? Options are dysmenorrhea, infertility, breast cancer, and the cervical cancer. So what is not comes under the gynecological disease? So the answer is the breast cancer. Breast cancer is not comes under any gynecological disease or a reproductive system. Breast is nothing but it's a enlarged kind of a sebaceous gland. Okay, it's an enlarged kind of a sebaceous gland is a breast. So breast will not comes under gynecological disease or a reproductive system. So dysmenorrhea, infertility, cervical cancer, all this comes under reproductive system. So the right answer is breast cancer is not a gynecological disease. Breast cancer and cervical cancer are the types of cancer that can affect a woman, but it is not a gynecological disease. Understood? Yes. Next. Which of the following can be found in the eyes during the physical examination of a newborn? So what changes can be seen in the eyes, especially in the newborn? The question is they're asking like that. So the options are Epstein pearls and brushfield spots, subglacial hemorrhage, and Adam's fringe. So what is the right answer? The answer is brushfield spots. It's nothing but when you are doing the physical examination of the newborn eye, you can see the white or grayish specks that are located on the periphery of the iris. I'll show the picture. It is especially seen in the child, the newborn with the Down syndrome. Normally, it won't be seen in the normal newborn. It is especially seen in the Down syndrome babies. That is called brush field spots. I'll show the picture. You can see this is the brush field spots. Okay, white grays in the outer layer of the iris. Can you see this? This is brush field spot. What is Epstein pills? Epstein pills, you can see it in the mouth of the baby, in the upper part of the baby, a white ball-like structures. Okay, normally present in the newborns. Sometimes it is present in the upper molar also. Sorry, upper near to the teeth. Okay, gums. Sorry, it's near to the gums. That is Epstein pills. Next, they have asked subglacial hemorrhages, otherwise called a subgaleal hemorrhage. There is an hemorrhage between the periosteum and the gallia aponeurotica. Okay, that is called a subgaleal hemorrhage. There is a periosteal layer will be there in the child newborn's head, and there is a layer called gallia aponeurotica. So in between these two layers, there is a hemorrhage called a subgaleal hemorrhage. Then what is Adamson's fringe? It is seen in the hair follicle near to the keratogenous zone. Upper part of the keratogenous part is called Adamson's fringe. Clear? So here the right answer is brush field spots, especially seen in the Down syndrome's newborn baby's eyes. Clear? Next question. What is the Apgar score of the following baby? So they given the scenario. So according to that, we have to give the score so that we can get the Apgar score. The scenario is the baby sneezes when the catheter is placed in his nostril and is actively moving but not crying. Pulse 95. Breathing slow and irregular. The body is pink but the extremities are blue. So according to the scenario, we have to give the score. So what is the correct score is 7. How can we give the score? For that, we should know the Apgar score. So Apgar scoring system, we will know that. So according to that points, we can give the score. Come to the scenario. The baby sneezes when the catheter is placed in his nostril. So what is the score we'll give? Sneezing means it comes under what? It comes under grimace. Okay. So when there is a stimulation, prompt response is happening. What stimulation they are giving? They are using the catheter to touch the nostril. There is a sneezing. So we have to give the score 2. Next is actively moving but not crying. It comes under activity. So we have to give the score 1. Next, pulse is 95. So pulse is 95 means score 1. Breathing slow and irregular. That means score 1. The body is pink but the extremities are blue. Body is pink and extremities are blue. The color. So you have to give the score 1. So total score is 7. So like that, you should know the Apgar scoring. Then only you can give the scoring. Then only you can answer this type of question. Clear? Yes. Next, the hemoglobin types found in a normal adult are. So in normal adult blood, we have mainly three types of hemoglobin will be present in our body. So what are they? So option A is SAF, option B is AA to C, option C is A to F, option D is A2 and F. So what is the right answer? The answer is A2 and F. So normally what will have adult type? A is an adult type. We will have 95 to 98%. We will have this type of hemoglobin, type A hemoglobin. Next is adult type 2. This also will have 2 to 3% in our body. Next is F type. Fetal type of hemoglobin will be present in our body. That is less than 1%. So these are the normal type of hemoglobin present in the normal adult. Type A, type A2 and type F. In option A, SAF. AF will be there but not S. S type of hemoglobin will be present in the sickle type of hemoglobin, that is called S type. Okay. And option B, A2 will be there, not C. C is we seen in the HbA1c patients. When there is a more hemoglobin combined with the glucose, that will comes under C type. That is also abnormal. Here they given only A2 and F, not A. So option A, B, C is wrong. Option D is the right answer. A2, F. The hemoglobin types found in a normal adult. It is A2 and F. Clear? Yes. Okay, we are completed today's session. I hope it will be helpful for your exams. Please, who are not subscribed our Metier channel, please subscribe our channel and press the icon button, bell icon button, so that you can get the notification of all the vacancies and questions also. Thank you so much. We'll see you in the next class.